All right, so I am honored to present to you guys on behalf of the Parker University Research Center, our work titled Attitudes, Beliefs, and Recommendations for Chronic Low Back Pain Patients, Cross-Sectional Surveys of a Chiropractic Teaching Institution. So I also want to acknowledge my co-authors, Drs. Jesse Cooper, Jordan Gliedt, and Parker's own Dr. Catherine Pohlman. And before we dive in, I just want to acknowledge that I have received a generous grant from Parker University, and I'm an honorary postdoc for the Parker Research Center, as well as my full-time position is as a health services research and development postdoc for the VA and a postdoc for the Yale Center of Medical Informatics. So to give a little background on our work, obviously, as we know in our setting, low back pain is a highly prevalent condition, and it's the primary cause of disability globally, and it's also the most commonly reported pain condition to healthcare providers in the United States. What we know about beliefs regarding chronic low back pain is that the functional outcomes of patients with this condition may actually be significantly impacted by their attitudes and beliefs about their own condition. We also know that projected beliefs of healthcare providers may play a role in shaping patient beliefs. We have some evidence to suggest that students' beliefs regarding chronic low back pain may persist into their time in practice. However, the attitudes and beliefs regarding chronic low back pain patients in chiropractic students and faculty is still relatively unknown, which leads us to our objective for this study. Our objective was to assess chiropractic student and faculty attitudes and beliefs regarding chronic low back pain, as well as their work and activity recommendations for these patients. So what did we do? We collected cross-sectional surveys from students and faculty at Parker in 2018 and in 2020. Surveys included the healthcare provider's pain and impairment relationship scale, as well as clinical vignettes. So the healthcare provider pain and impairment relationship scale, we'll call HC pairs, is a 15-item questionnaire. Questions are centered around if chronic low back pain justifies disability and ceasing work and activities. Each question is on a 1 to 7 point rating scale, with a 1 meaning the provider completely disagrees and a 7 meaning they completely agree that chronic low back pain justifies disability. So here we're actually looking for a lower score to indicate more appropriate beliefs on the HC pairs. For the clinical vignettes, we use these to evaluate providers' work and activity recommendations regarding chronic low back pain patients. Recommendations were rated as adequate, neutral, or inadequate, with adequate recommendations being advice to remain active and not limit work and other activities. So here you can see that our response rates were a bit lower in 2020 compared to 2018, and this is likely due to the COVID pandemic. Here you can see our overall means HC pair scores by students and faculty in both 2018 and 2020. So as you can see here, the faculty scores were typically lower than student mean HC pair scores. And again, I want to highlight that a lower score indicates more appropriate beliefs regarding chronic low back pain for the HC pairs. And we can also see that there was a statistically significant difference from 2018 to 2020 in mean student scores. Here we can see the mean scores for students by year across trimesters. You can see that there's a slight trend towards lower scores as the trimesters increase. So this could mean that the longer students are in the chiropractic program, the more appropriate their beliefs become. And then we also can see that mean tri 3 and 4 scores in 2020 were statistically significantly lower than in 2018, but there was no significant difference for any other trimesters. Here you can see the results for students and faculty from the clinical vignettes, showing the percentage that gave adequate, neutral, or inadequate activity and work recommendations in both 2018 and 2020. So our main takeaway from these charts is that faculty provided more adequate recommendations than students for both activity and work in both 2018 and 2020. This tells us that perhaps clinical practice and more experience plays a role in giving more frequent, adequate recommendations. The percentages for students and faculty between 2018 and 2020 were quite similar, with none of the changes in recommendations between the years being statistically significant. So throughout the discussion section, you'll see that the results from our present study are going to be highlighted in orange, and the results from the literature will be highlighted in blue. And again, I want to remind you that for the HC pairs scores, a lower score indicates more appropriate beliefs. So here we can see that students from our present study had higher scores than some of students from other literature. And here you can see that faculty had pretty comparable scores to some of their counterparts as professionals in literature, but they were a little bit higher than most. And now we'll switch over to adequate activity and work recommendations. So here we're looking for the scores to actually be higher. So here you can see students less frequently gave adequate activity recommendations than their counterparts in the literature. And again, students frequently gave less adequate work recommendations than their counterparts in the literature. But interestingly enough, we found that faculty in the present study actually gave more adequate activity recommendations than some of their counterparts as professionals in the literature. And similarly, faculty recommendations were comparable to their counterparts in the literature for work recommendations. So I just want to identify some of the limitations of our present study. So like I spoke about before, the response rates were lower in 2020, likely due to complications from COVID. The results of this study are cross-sectional in nature and not longitudinal, so we didn't follow individuals as they progressed through the program. And then obviously the results of this study only represent one institution, so there's limited generalizability to other chiropractic teaching programs, and we did not use an intervention. So what can we conclude from this study? The results of our study indicate that students at a chiropractic teaching institution believe more strongly than the faculty that low back pain justifies disability and limitation of activity. It also indicates that students provide adequate activity and work recommendations less frequently than the faculty. Student and faculty scores indicate less appropriate beliefs than their counterparts in the literature, of course, with exception of the faculty adequate activity and work recommendations being comparable to their counterparts. This type of work highlights the importance of measuring these scores. As leaders in the chiropractic profession and education, we should strive to ensure student and faculty beliefs regarding chronic low back pain patients are appropriate. Future research, we should use educational interventions, and we should measure the subsequent impact of these interventions on scores as well as clinical outcomes. And thanks so much for your time. And if you have any questions regarding this presentation, feel free to email me at the email on the screen.